Finally, it's important to have access with an intravenous IV line or interosseous IO line in place as soon as possible so that it's ready in case you need to start giving medications. Compressions and ventilation are started immediately on patients without a pulse. However, as soon as an AED or cardiac monitor or defibrillator is available, using it becomes the most important step. The ACLS team needs to troubleshoot the non-functioning heart by diagnosing the cardiac rhythm and defibrillating if indicated. Chest compressions should be paused briefly to apply and use the AED or cardiac monitor. This allows accurate assessment of the rhythm on the ECG and determines whether it's a shockable rhythm, like ventricular fibrillation or VFib, and pulseless ventricular tachycardia or VT, as well as a non-shockable rhythm like asystole and pulseless electrical activity or PEA. In ACLS, ECG interpretation is guided by 3 questions. Is the rhythm fast or slow? Are the QRS complexes wide or narrow? And is the rhythm regular or irregular? Rhythms where a defibrillator can be used to shock a patient, shockable rhythms, are ones that are fast and have a wide QRS complex. After that, VT is a regular rhythm, whereas VFib is an irregular rhythm. If either VT or VFib is found, defibrillation should be done as soon as possible. Defibrillation with a synchronized shock is given when there's a regular rhythm, like in VT, whereas an unsynchronized shock is given when there's no regular rhythm, like in VFib. The initial dose of energy that the defibrillator delivers typically ranges between 120 to 200 joules, but a maximum dose can always be used even on the first attempt. Immediately after delivering the shock, chest compressions must be resumed right away without reassessing the rhythm. After 2 minutes of chest compressions, there's a new evaluation of the rhythm through ECG. If the rhythm is still shockable, a second shock is given using the maximum available dose of energy. In addition, 1 milligram of epinephrine is given using the IV line. All medications should be followed by a saline flush or by raising the patient's arm to guarantee that the medication travels all the way to the heart. Once we start using epinephrine, it's continuously given every 3 to 5 minutes while chest compressions are being performed. After 2 minutes of chest compressions, or when there's a rotation of the person doing CPR, the rhythm is checked again. The rhythm is still shockable after a third defibrillation attempt. 300 milligrams of amiodarone may be administered intravenously as well, with a repeat dose of 150 milligrams